Do you ever wonder how people travel so well? Like, I don't, like, then they look beautiful when they travel. Like, how do they do that?
I don't know, because that's definitely not me, which, by the way, we are recording. So welcome to Vaginas and Vertebrae. We were just talking about our massive bags that are under both of our eyes, mainly because I've had like this 2-week binge of traveling. I'm not used to that. And Madeline was like, do you ever see those people that travel and they just look fantastic? Yes.
If you're one of those people, let us know.
Yeah. Like, what are the secrets? Like, is it a serum that I'm not buying? Is it like collagen? Like, what do I need?
I bet it's the collagen.
Yeah. I put collagen in my coffee. I should be doing pretty good.
Too. I know.
It's not doing it for the bags. Anyways, welcome to Vaginas and Vertebrae. We are super excited, as always. Funny, we are actually not side by side this time. We're doing this via Zoom. We're in different states. I'm traveling, so I'm all the way up in, I always say the name, I think it's Swedesboro, New Jersey is where I'm at right now.
Oh, you're in New Jersey.
Yeah, it's like outside of Philadelphia, and it is cold AF up here, and I am not a fan of 49 degrees. But I'm here, and I'm ready, and I'm, don't have a jacket that's thick enough, but I'm going to find some sleeves.
Some sleeves.
I might just wear the comforter from the hotel bed to the wedding today and just like do it that way. But
that'd be beautiful.
Yeah. So today, anyways, enough chit chat. Today we're actually talking about 2 questions. Well, one question actually that we get asked a lot, or at least I know I do. I ask my clients during the intake paperwork, and I also ask them during an evaluation, are you seeing a chiropractor? And then I find a lot of times that they're like, oh yeah, but I don't really like them, or, oh yeah, but I don't really know if it's going to work out, or if my plan of care is good, or also I don't know how to find one. So I wanted to really open up the floor, because I'm not the chiropractor, I'm the pelvic PT, and I just help people find chiropractors. But I would love to be able to hear your thoughts, Madeline, on all of those amazing things that we need to be looking for in a chiropractic provider if the client is pregnant or postpartum, I would say would be our specific target right now.
Right. So yeah, we are going to focus on that population for this discussion, because it would be way too overwhelming if we didn't focus on a population. And as you guys know, Dr. Kaylee and I typically see a lot of pregnant and postpartum moms. So that's more of our jam. I would say number one thing to definitely check for, even if you're not pregnant yet, but you're planning to be and you want support to that motherhood transition, is a Webster certified chiropractor. Mm-hmm. So it is extra certification, extra training that we do go and take that just addresses more of what that mom is going through as she's going through her pregnancy, and how the body's changing with that, and then postpartum as body is starting to get back to its new normal in that process. And not every chiropractor has that. That's huge to hit on. They might tell you they can adjust you if you're pregnant, and yeah, maybe they can, but not every chiropractor is Webster certified. And there is a huge difference in care that the mom gets when they are going to a Webster certified doc.
And I also have a question about that, just me and my ignorance of not understanding 100%, but is a chiropractor that is adjusting a woman who is pregnant, is that dangerous at all if they have not had that extra training?
I don't like this. I hate that question, because I always feel like, for a long time I would tell people, it's okay, at least you're getting adjusted. But then I keep seeing moms show up into my practice who I wouldn't say necessarily have been, maybe they've been quote unquote hurt, or maybe they just didn't respond well to an adjustment. But they're just like, they're not even getting like what their low back adjusted, because these doctors don't have the tools to allow mom to lay on their belly so they can properly assess what's going on in their like hip region and area. So I don't know, like, they're really going to get hurt or like damaged, but they're not going to get the full benefits, especially if they are looking to be supported if their baby is not in proper position. There's a huge difference that comes with that in the care you get with a Webster certified chiro versus one that doesn't know how to do Webster.
Okay.
So at this point, I just full out all transparency. I tell my moms, like, and they might be with a chiropractor that they love, and I get that, but I'm like, if they're not Webster certified and you're pregnant, you need to be with a Webster certified chiropractor during that time.
Okay. Nice. Nice. I like that, because I have clients ask me that all the time. Well, I am seeing a chiropractor, and I'm like, are they Webster certified? And because that's my next question, just based on what I've learned. And a lot of times my clients will be like, I don't know. And to me, it's just like, okay, that's nice, but let's ask the question and let's just start the conversation. I'm
Yeah.
not saying by any means that like you can't see a chiropractor that is not a Webster certified. I'm just saying if you're pregnant and postpartum, they do have a little bit more extra training. And like Dr. Madeline said, they do have the tools, which I know as a pelvic PT as well, it's different from generalized physical therapy. So it is important for you to be able to distinguish the difference between having that certification versus not. So thank you for clarifying that, because I never know how to answer that question, because I'm like, I don't think so, but I don't know.
I know. It's like they kind of put you in a corner a little bit, because you're like, I mean, no, but yeah, but I'm like, ultimately, I try to relate it this way. It makes sense in my head. Maybe it'll make sense in yours. Like, if I was to become pregnant, I wouldn't go from my pregnancy care to my primary care at that point. I would be switching to a midwife or an OB or something like that to assist with me during that process. Yep. So they have special training to help that woman through her motherhood transition through pregnancy and postpartum. So I kind of relate it the same way.
Nice. I like that. I like that way of saying that and breaking it down, because it's easy to understand. It makes a lot of sense. So awesome. Are there any other certifications or things that you would recommend people look for in a chiropractor, especially during pregnancy and postpartum?
Yeah. So we already talked about Webster, which is definitely number one and huge. And then I would look for somebody who has done training with BirthFit. So BirthFit is a movement that helps women through their motherhood transition, and they do focus on 4 pillars, which is fitness, nutrition, mindset, and connection. And not everyone has taken that extra training as well, but I find it just allows you to help that mom even more and connect with her, because in our society, typically, like, women are scared to give birth because they've constantly been told that they're not able to do it, that it's scary, it's going to hurt, they can't do it on their own, they can't do it without meds, like all these scary things. So there's a lot of mindset work that goes into that and prepping that mom to help her with that, as well as birth is literally the most physical thing that woman has a chance of going through in her life. So why are we not physically prepping her for that as well? Most of us would never try to go run a marathon and never train for it. So why, when a woman's pregnant, are we not encouraging her to work out, and to work out in a way that like really supports her and trains her for what she's getting ready to go through? Because I know you see this a lot too, women that come in and their doctors told them, well, yeah, you can work out, but don't lift more than 10 pounds. And let's say they're like second-time moms and they have a 2-year-old at home and they're pregnant again, and they're telling them don't lift more than 10 pounds. They're like, well, that's just not going to happen. It's not a reality.
How am I supposed to lift my own body weight?
Right.
Just for the record.
Yeah. Right. Like blows my mind.
Oh, it's insane. I agree with that. Yeah. Okay. Awesome. So BirthFit and Webster certified are 2 big things that we need to be looking for. BirthFit's really cool too. They have a ton of resources on their website if you all are interested in checking that out. If you are in the Tampa Bay area, reach out to Dr. Madeline about BirthFit, because she's got a lot of cool things that she does with them and has a lot of information. I love the principles that they have and how they support, because the mindset is so important. And I would say that technically leads us into that next thing that I would say you want to look for in a chiropractor is just, are you comfortable with them? Have you interviewed 100%. The chiropractor? Are they giving you 100%. The option to have a conversation before you pay them any money? I think that's super important. And I don't know what your thoughts are there, but I think it's really important to be able to like get along with them, have good vibes from them, make sure that you're comfortable telling them, because Webster certified chiropractors ask different questions than general chiropractic, because we do have to talk about the baby and pregnancy and birth and like all these things that are a little more personalized. Right. So I think it's important to do that.
You definitely have to trust your chiropractor, which I think a lot of people, if they've went through chiropractic, they find anyway. It's hard. You need to connect with them. You need to trust with them, because it is like they are touching you, which I would say like most people aren't really used to being touched too much in our society, especially by a healthcare professional, really. So we do spend time with you, and we are part of your family, and typically we have more time to spend with you maybe than your primary care. So we do connect on a different level. So trusting them, especially like you said, during that process, if you are pregnant, postpartum, because when you're coming in, I'm asking you, especially like all the time, but especially postpartum, are you okay? Are you supported? Where are you struggling that maybe you aren't comfortable talking about with friends or family, or maybe you've tried and you're not getting the support you need there, and you'll hear like things that moms literally could be like next to their best friend that just had a baby and they don't talk about it. So then they're like, am I weird? Is something wrong with me? And they have all this in their head as well. So I would say you want somebody who's educated and knowledgeable in those topics and that you can trust, that you feel comfortable with to have that conversation.
Yeah. It's somebody that's willing to just give you space to talk about things too, because I hear often, which eventually will lead us into our next kind of like topic here, but I hear often my clients will come in and they're like, yeah, I see my chiropractor. I see him for 2 minutes and that's it. Like, we don't talk. I don't know anything. Like, I don't really know why I'm getting the treatments that I'm getting. And I hear that in the PT realm all the time too. And it's just, to me, that takes out that whole safety aspect, right? And so the way that Dr. Madeline and Dr. Johanna run their practice is amazing, because they give you that space and the ability to be able to talk and to communicate with them and actually ask them questions in a space to feel comfortable in. And I think that that's really important. And I'm going to let you take the floor on why you're able to do that and how you guys have kind of structured your practice in that realm and what made you make those choices, because I think that it's really important to hear the difference, and me just as another provider, hearing the difference from a client coming from a chiropractor where they felt like they had no space or no support or nothing but the adjustment was occurring, like no mindset, no talking, no nothing. And then they go to your practice and then they're like, oh, like, this is a new world. Like, I feel much better. I feel protected. I'm supported. I feel calm. I feel safe. And for me, as another provider that refers to you all, I'm just like, those are the like things that I look for, because that's what I give. But I want to make sure that I'm sending people to places that they are getting that as well. So that kind of leads into the, like, when clients are looking, and we get this question so many times, and we're probably going to end up doing a whole episode of its own about this question specifically. Why, Dr. Madeline, and I'll answer this when we're doing the PT one, but why are you a cash pay chiropractor versus a chiropractor that takes insurance?
Because I get to give you the care that you specifically need without someone else dictating that. When you bring insurance into the game, they get to dictate your care and your plan of care and how long you should have care and what should be done with you. They don't know you. They've never sat down and done an exam with you. They don't know what's going on in your life, what's going on in your body, like any of those things. So we choose not to play the game, because it's a game, guys. And I know, like, we don't always realize that because we pay for it and it's there to protect us and help us, and I get that. But it's just, it doesn't really serve you, especially in like a wellness world. It's more for like, catastrophe type of things. But we choose not to play the game that they try to play, because we want the patient that's in front of us to get the results that they're looking for, which means that we just don't take it. We don't deal with it. And it allows us to, like, they're not dictating how much time we have with the patient, all of that. And Dr. Johanna and I definitely came from practices that were very busy. We call them like high volume. You see people for a couple minutes and then like they're gone. And when we opened up our own practice, our goal with that was to have more space and more time with our patients, especially we knew like our pregnant and postpartum moms needed more of that time. You can't just get them in and get them out in like 2 minutes and then really address all of the other factors we talked about mindset. Do they need to talk about fitness? Maybe they need to just sit down and talk to you and vent for like 10 to 15 minutes. Maybe they have to feed baby when they're there. Like, we wanted a space that was safe and comfortable for all of that. And for no one to feel rushed. So, and if we took insurance, it gets to dictate that. And we keep our prices comparable, we try to as much as possible. But we don't play the game.
Yeah, and it's a really hard decision to make too. I think, people brush it off and they're just like, oh, well, you're a cash pay because you just want to make money. But there's so much that goes into that. And I think that it's really important for clients to just understand that you have the choice to choose to go to an insurance provider versus a concierge. And I call it concierge. And to me, concierge means that your care is like top shelf. Like, you're getting like, what do you call it? Patron, not like the cheap shit, right? Like, it's just, you've got to be able to be comparable. I think someone had described it to me. They were like, it's like flying first class versus economy.
Right.
So it's what kind of care are you looking for? And who are you looking for to provide that care? Are you looking for someone that's burnt out seeing 50 plus patients a day? Are you looking for someone that is seeing, 15 to 20, maybe a little bit more, but is able to offer that space to you?
Mm-hmm.
Because especially in pregnancy and postpartum, I see the transitions in the mental state, right? And so do you. And so it's just important to be safe and comfortable and know that, man, I have to nurse and I have my appointment, but I know that I'll be able to do that because I can go in and I can nurse and then I can get my treatment and then I'm good to go, right? And so it's just really important to understand that you're there, and we can chat with you about nursing positions and things like that. And Dr. Madeline can go over your exercises, whatever it is that she has to give you for aftercare. It's just a beautiful way to do business, and it's a beautiful way to be able to get to know your clients, because I can also vouch for the fact that your clients become just as close to you as my clients come to me. And so it's just really fun to see that, and it's almost impossible to do that when you see so many under the insurance model.
It is. And, I've been other practices that were cash-based that weren't even insurance, that I was seeing like 60 people in like 6 hours. And for the practice, for me, it was too much. Like, I couldn't talk to every single one of them, really listen to what was going on, address what was going on in their care, like their plan of care and where they were. And if anything new popped up, like, there just wasn't time. There wasn't time to like for any of that. And then if I had a pregnant mom come in within that, their care does take longer than 5 minutes. And it was stressful for me because I knew I wasn't giving back to the patient the way that the patient deserved to be and how I wanted to provide care for them. So that's not fair. It's not fair to me as a doctor, and it's not fair to the patient.
Yeah.
So we set it up so we can give to the patient the way that we want to and the way that they deserve to be given to.
Yeah. I love that. That's awesome. Yeah. Is there anything else that you can think of that is like, oh my gosh, this is so important that you look for in a chiropractor when you're pregnant or postpartum?
I think honestly, like we touched on it a little bit, but definitely interview your doctor. And this is not just chiropractor or PT. This can be your MD. This can be your OB, anybody. Like, interview them, because you're paying them. You are hiring them. So if you walk into a practice and you don't feel comfortable and your gut's telling you something's weird here, or you walk in and they're not doing an exam or talking to you and they're just trying to adjust you, like, listen to all those warning signs and those red flags. If you're talking to them and you don't feel heard or supported in the right way, know that there's other doctors out there that will listen to you. And I know sometimes it can kind of, it can be exhausting looking for the right fit, but know that they are out there. If you have a little bit more direct questions, of course, you can always find me and message me, and I help people look for chiropractors all the time in different areas or even locally, that type of thing. So, but finding the right one, because I've had moms come in who were like, I just didn't feel comfortable with where I went prior to you. And they would feel uncomfortable every single time they walked in there, or there wasn't an exam done initially at all at any point on them. They were just adjusted. And I'm like, well, they didn't talk to you? I don't, like, none of that, listen to that, because it's your body telling you something's not right.
Yeah.
If you're not comfortable. So,
and I think that's important that you brought that up with like all professions too, because I tell my clients all the time, when they're looking for a midwife, when you're looking for an OB or whatever it might be, get a list of the ones that you want to meet and the ones that have been referred to you, and make sure that you have a sit down talk with them.
Yeah.
You want to sit down, you want to chat with them, or you want to call them on the phone, whatever it might be, and just say, hey, these are the thoughts that I have. This is what I truly want. What are your thoughts there? How do you do this? Or what can you do for me, type thing? And don't be afraid to ask those questions, because if the doctor is upset that you're asking them those questions, then you probably want to not go there.
Agreed.
So, it's important to do that. And I do that religiously, and everyone makes fun of me because I'm just like, well, what are your intentions with my care? And I can't help it.
Especially, I think everybody should be doing this, whether you're a woman, a man, like any of that, but especially if you're pregnant and you are looking for that person that is going to walk that journey with you as you are prepping for labor and bringing baby earthside, because as we know, and we should have a plan in the best case, what we want, but birth is birth, and it's magical and it's crazy and it's going to do what it wants. So you want somebody on your team that you feel completely supported by and heard by, and not when you get into that labor starting to happen that you're getting bulldozed over and wait, none of my wishes are being respected and things like that. And unfortunately that happens.
Yep.
Time again. It does. And it's very sad. So
yeah, it is sad. It is sad. So definitely pay attention to all of those tips when you're looking for a chiropractor, or reach out to me or Dr. Madeline and say, hey, this is where I live. This is what I'm dealing with. And I would really like to be able to find a chiropractor, because we've talked in previous episodes how amazing it is to have a chiropractor on your team, especially for your birth team and being preparing for labor and delivery. So it's one of those things that you just need to have in the back of your mind on, how do I find the right one for me? Yeah. And then when you find one, it's hilarious to me, because it's like you find the right chiropractor and you're just stuck for life. Like it's just it's the most amazing thing, because you have the maintenance programs, and it's so beautiful because like you're able to get the care that you deserve, and you feel so confident and comfortable. And then you refer all your friends because you feel so good. So you're just like, yes, chiropractors, I love it. And I love hearing that. And it's really, really cool to see that. And as a friend of Dr. Madeline's, it's really fun to watch that in her growth through business, because we're both fairly new in business, but it's been really fun to watch that growth and hear all of those amazing testimonials on how she's been running her practice and treating her patients. And I love that. So it's really fun to see that. We have amazing chiropractors in Tampa Bay. There's several of them. But we are more than happy to find you someone else if St. Pete's not your area, or if there's other needs that you have that someone else can provide better. So don't be afraid to reach out. Those are our tips for how to find the right chiropractor that you can stick with for life. Yeah. And we will be back next week for our episode on how to find the right pelvic floor physical therapist. I'm excited about that one, because we are talking all things about vaginas. And as everyone knows, you see and you touch a vagina as a pelvic PT. So it's so important to find the right one for your plan of care. So until then, we will see you next time.
Bye.